Hi student, today is examination of functional status and activity level. First heading ICIDH. In the World Health Organization described the international classification of impairment, disability and handicap. First itself disease. Disease leads to primary impairment leads to disability leads to handicap. An example of ICDH, disease example of stroke. In stroke, the primary impairment is the hemiplegia, right hemiplegia or left hemiplegia. Then disability is unable to walk, unable to perform the activities. In next stage is the handicapped. The term is called as handicapped. Nagging model is the first disease to pathology to impairment to functional limitation to disability. Okay. The same example, stroke is a disease, pathology is the hemorrhagic or ischemic stroke, this impairment is the unable to perform the activities of the upper limb and lower limbs. Functional limitation is the unable to move the environment, society, and to move activities of food, eating, bathing. These are activities are disabled. Then leads to disability, unable to move independently to society. The term is a disability. History, 2001, the International Classification of Functional Disability, Functional Health and Disability. First is the activity and participation, capacity in the standardized environment, and performance in the actual environment. Physical function, the sensory skill for ADL, basic ADL, activities daily living, instrumental ADL, activity daily living. Then recreational activities, not only sports, stamp collecting, chess, etc. Activities for daily living, examples are eating, bathing, toileting, dressing, grooming. These are activities of daily living. Instrumental based is the housework, money management, gets outside medicines, take medicine, telephone use. These are the instrumental used. And then psychological function. Psychological function is that two factor, mental and affective. Mental factor is the cognitive abilities. Cognitive ability is the affective the skills of copying strategy. Then initiative the attention, concentration, memory, problem solving, judgment. This self-esteem is affective the self-esteem, attitude towards and body image, anxiety and depression. Social function, in the individual performance of the social role and the application. Examination and purpose. Purpose is the first line of baseline information for setting function oriented goal and outcome of intervention. Second is the indicators of the patient's initial ability and progression towards more complex function. Then purpose. Then another one is the criteria for placement decision, need for inpatient rehab. Then manifestation of individual level of safety in performing a particular task and risk of injury with continued performance. Then evidence of effectiveness of specific intervention or function. Then the general consideration. Physiotherapist typically responsible for testing functional mobility skill, bed mobility, transfer, locomotion, activities of daily living and instrumental activities of daily living. Data need to describe habitual level of the patient ability to do certain task activities, to patient's capacity to perform certain tasks and activities. How should be testing and setting? First, the free of distraction. That is instruction should be precise the analogous. Then energy fluctuation to be noted, used for interpretation, information from functional task interpreted in the context provided by other data during initial assessment. Okay student, today we will stop the topic. In the next class we will continue this section. Thank you.